We are live. We are live. We are live. I'm Dr. Frita. Welcome to the trending health topics and the headlines in celebrity health. Welcome, welcome, welcome. I have a jam-packed show for you today. I hope y'all had a great holiday. We're going to open up with a very unhappy story from someone who I've watched over the years and who says, "Don't cry for him, Argentina." And it's Funky Dineva. Funky Dineva. He is one of the original content creators on YouTube, and he's very transparent. And he's only 42 years old, and he shared with us the whole step of the way as I've watched his shows that he was going to get his routine health care, get his prostate screening, and the results came back that he actually has prostate cancer. It's a low grade, it's an early stage, and so I want to applaud him for sharing his story and for continuing to show strength despite what I know must be, very challenging. And as always, we'll use this as a teachable moment for all of us as far as what to do for prostate cancer awareness and just taking care of ourselves and facing health head on. And then for our next story, we'll talk about Campbell's soup. Raise your hand if you've ever had Campbell's soup or if it's a little staple in your closet. Well, the Campbell's executive, one of them, allegedly calls it poor food, allegedly was putting out racist comments, allegedly said that the chicken's not real, it's made with 3D chickens. There's all kinds of controversy. So we'll talk about that. And then we'll talk about access and what really is poor people's food and why is there such thing as poor people's foods and what is a food desert. Then we'll get into my favorite little game, myth versus fact. So if you've ever heard of Donald Glover, also formerly at least known as Childish Gambino, his stage name, well, he shared that he's only 42 years of age and he actually had a stroke last year. And the reason he had it might surprise you. It's not from the typical risk factors. He has a hole in his heart. And then, so we'll talk about that myth versus fact when it comes to strokes in young people and with the hole in the heart. And then we'll move into our second weekly dose, okay? Well, I'll give you a fresh take on the headlines you simply can't get anywhere else. We'll talk about norovirus because there's some startling facts about norovirus. It's on the rise, actually. It's doubled, actually. And so we'll talk about norovirus, how to prevent it. And then we'll talk about brain rot. I know that's very fun and exciting. But for those of you who like to be on TikTok, Instagram, YouTube, hello, everybody on YouTube. What will you do if I tell you that a new study is showing that some of this short form content and social media content is literally causing brain rot? Yeah, this is a real study. Anyway, let's go ahead and get started. I'm going to ask you questions. You ask me questions. We are live. I'm Dr. Frita. Let's get started. Hello, hello. We're live. I'm Dr. Frita. Welcome to the trending hot health topics in the headlines and celebrity health. I'm going to give y'all a really good evidence-based session of medical information, but I'm not doing it alone. Please, for my office manager and co-host, Ms. Shador, please come on to the front of the stage. How you doing, Ms. Shador?
Good, Dr. Frita. How are you?
Good. How was your holiday? It was happy and healthy, I hope.
Yes, happy and healthy and full of people. How about yours?
Very good, very good. We did some traveling, went and had Thanksgiving dinner with my cousin Dawn in South Carolina, had a great time. And, my oldest baby, my college student from FAMU came to town. She left yesterday. Why did I sit here and try to cry when she left? I don't know what my problem was.
Did you really? Oh, my God.
Oh, she's come and gone a million times. I think normally she leaves, the house is full of people. My parents are here. I got this and that to do. But when she left this time, I happened to be in the house alone with the dogs. And everything just felt so lonely.
And it set in. Oh, gosh.
And then I guess maybe I'm thinking, she's a sophomore and then junior and then senior and then just time is moving. You know what I mean?
Absolutely.
Yeah, but a lot to be grateful for. One thing, if you have your health, you got to be grateful for your health. You have to be grateful for your health as well, because a lot of people, unfortunately, right now are having to face health problems. Shador, who was the first person in the chat?
First person in the chat today was Miss Lisa J.
Hey, Miss Lisa J, welcome.
It's good afternoon, everyone, and happy holidays. And we have a new member,
Yeah, who's our member? Who's our member?
Miss Velva. Hello, welcome to the membership or to the
Thank
Medhead.
Wonderful. Thank you for being a med head. Well, depending on the tier that you join, if you are at least at the resident level, then you'll be able to go and enjoy a lot of members only content. I definitely put out some content. Oh, over the holiday. Over the holiday, I put out some content that I believe you'll enjoy, and I share some things over there for my members. I don't share for other places. And then if you join at the highest tier, then every month we have our monthly live Q&A, members only, where you have access. You ask me questions for the entire time, and I give you, insight from my medical point of view. What is my point of view? Well, for those of you who are new to us here on the Dr. Frita channel, I am Dr. Frita. I'm an MD. I'm a medical doctor. I've been quadruple board certified. So I am a board certified nephrologist, meaning I'm a kidney doctor and a high blood pressure doctor. I have also been board certified in internal medicine, pediatrics, obesity medicine. And so I love to read and to learn about a lot, but more importantly, I love to share it. And so when you become a member at the highest level, then every single month you have absolute full access to my insights on different medical information. You can ask me as many questions as you want. You can come up on stage. And so it's really just a great way to get a chance to kind of pick my brain for information on a more personal level. So I appreciate you, and I appreciate everyone who joins us. And a free way to support the channel is to go ahead and to give us a like and to share this information. Let YouTube know we're here, and make sure you give us a subscribe if you haven't. I'm very proud to say that we have over 920,000 subscribers here on YouTube. We are marching toward 1 million subscribers. Y'all know what that means? I'm just so excited, and I appreciate you, because we make great effort to give you evidence-based medical information in a way that's easy to understand. I have hundreds of videos on this channel, and I give it to you in a digestible way, so that if you're going to see your doctor, or if you have an abnormal lab, or if a family member is going through something, they can watch my content. And so then when you do go in to see your doctor, you are more well informed, and the squeaky wheel gets the oil when you're able to present and ask questions in a certain way based on information you've learned from my videos. It helps you to better advocate for yourself. It helps to decrease the chances of you being overlooked or dismissed. Okay. And so thank you for joining the membership, and thank you to all of you for being here on YouTube, on my other platforms, and the replay crew. I see you. All right. So let's go ahead and get started. Let's jump right on in. Shador, this first story does not make me happy at all. It doesn't make me happy at all. It's with Funky Dineva, who's been, one of the original YouTube content creators since like 2013, I believe. My sister, Jetty, introduced me to him. And yes, he is hilarious. He's definitely very comedic. He's also highly intellectual. He went to Florida State. I went to Florida State also. Hey, y'all. And he just gives really great content, has been doing it for years and years and years. He's transparent, very transparent about his life, including going to see his doctors and keeping up with his health care. So he did go and see his doctor, got his prostate checked, as you definitely should. He's a Black man over the age of 40, and he's 42 years old, and he was found to have prostate cancer. So let's play this clip, and then let's talk a bit about prostate cancer and ways that we can take care of ourselves.
All right, guys, so I just got back from the urologist, and let me preface with I'm sharing this information for educational purposes and not for sympathy, but I have stage 1 prostate cancer. They did 12 biopsies, and 2 of them came back cancerous. 1 of them came back suspicious or inconclusive. It is very, very early. He mentioned something about a Gleason score and that mine was extremely low. So he's like, it is, you caught it at the earliest of early phases, which is a good thing. He's going to send off my, blood work or biopsies to do some genetic testing on it to determine if it's a slow growing cancer or a fast growing cancer. So we can then begin to explore what our treatment options were. I fast forwarded, asked him what are my treatment options. He said radiation, some experimental drugs. and surgery by robot. And I just went ahead and told him, I don't need to wait for anything to come back. Let's just go ahead and remove it, do a surgery by robot. And I have an appointment on December 8th with the robot doctor to set up surgery to get it removed. I don't think, I mean, granted, they gave me a book to read or whatever, and I'll, read over it tonight and across the week. But right now, with very little education, my gut just tells me cut it out. I want it cut out. I don't want to go through radiation and all of these other things. So that's what's going on with me, guys. Don't cry for me, Argentina. Yes, I'm a little down about it, but I'm about to take a nap.
Yeah, so I'm real sorry to hear that. And for those of you who've been following me for a while, you know that I've been on his show. Once I was on the Funky Dineva show talking about BBLs, the truth about BBLs, and he had some guests who had actually had BBLs. Some had complications, and of course, I was talking about it from a medical perspective. The fact that BBLs, a Brazilian butt lift, how that is the most dangerous, most fatal form of plastic surgery that we have. So we talked about pros and cons, how to be safe on his show. And then my sister and one of my good friends got a chance to meet him last year face to face because he was hosting an event where he was donating toys. Okay. And I say that to say that, he has a lot of fun on his show and he goes for bad and he says things that are controversial, but, especially in person, he's very warm, very engaging. And he was just so excited, for the gift that he was able to inspire from all of us to these children in need. So just a good guy, just really a kind guy, and so I'm just praying for him, wishing him the best. And still, I especially appreciate him for being in the midst of this, where most of us would want to just shut down, and just tell everybody to be quiet. He's still putting the information out, not for himself, but so that others can, see that even if you're young and you're healthy and you're popping and you're locking, how cancer still can happen to you, but early detection is key. And so I want to talk some about prostate cancer, what it is, what the screening recommendations are, some of the signs and symptoms. And then really, I've been getting a lot of questions about what does that mean, what he's saying, stage and score and Gleason score. We'll talk about that. But as we do, I want you to put in the chat and what kind of symbol do I want y'all to put in there? I want you to put a Christmas tree. I want you to put a Christmas tree emoji in there in the chat and answer this question. What can we do to encourage our men to be more proactive about their health? Okay. What can we do? Give us some tips on how you get the men in your lives to be more proactive about their health. Put a Christmas tree. Okay. So now, prostate cancer. First off, what is the prostate? Well, the prostate is a walnut-shaped organ. It's only in people who were born as men, and it's located right under the bladder. So here you'll see a couple of prostates. One is normal, one has prostate cancer, but that big round structure you see is the bladder, and those tubes you see going up are the ureter. And so if you use your imagination and stretch to going up above the screen, the two kidneys would be there. So you have your kidneys, they go to the ureters, which take urine to the bladder, okay? And then that tube leading from the biggest structure is the urethra. That's the tube that takes your urine from the bladder to the outside world. Well, in men, wrapping around that urethra, wrapping around that tube is a little walnut-sized organ, and it's the prostate. And the purpose of the prostate, it's, what is the prostate for? You don't need it to live, but it is responsible for producing the fluid that helps to keep a male's reproductive fluid moist, okay? And so it produces a fluid that helps to go into semen, okay? So that's what it does. And with it wrapping around the prostate, with the prostate wrapping around that urethra, that tube, it also helps to prevent incontinence. It helps to prevent men from having leaky bladders. Well, if you develop prostate cancer, that means that some of the cells in the prostate become abnormal. They start growing abnormally, and they can grow if not detected early and spread to your lymph nodes, spread to other organs with prostate cancer. Prostate cancer is the second most commonly diagnosed cancer. It's only second to skin cancer. And it's just very, very common, and very specifically, it tends to be more common among Black males. It tends to be diagnosed in more aggressive stages at earlier ages in Black males. We're not completely sure why, but if you are a Black man, then definitely be sure that you consult with your doctor, especially by the age of 40, because the American Cancer Society recommends earlier prostate cancer screening in Black men. And so let's talk about what Funky Dineva shared. He said that his prostate cancer was found to be at an early stage, stage 1. So that simply means that the cancer was caught so early that it is relatively small and it has not spread beyond the prostate. Okay. They caught it early at a time where it's still inside the prostate. It hasn't gone to any lymph nodes. It hasn't gone to any seminal vesicles, like the part that helps to produce the fluid for semen. It hasn't gone to other organs. And when caught at that stage, the prognosis, the likelihood of surviving and doing well is very, very high. In fact, the good thing, if you can say good thing, but just one thing about prostate cancer is that it tends to be a very slow growing cancer. In fact, the 5-year survival rate for prostate cancer in the United States is near 98%. Okay, so that's the good news about it. So he had stage 1. The other thing he talked about is the Gleason score, which is one of the ways that helps him to stage how aggressive a cancer is. And he said that he was told that his Gleason score was very low. And so what they do for the Gleason score, okay, so they get biopsies. Funky Dineva shared they got 12 biopsies, so 12 samples of his prostate. And what they do for a Gleason score is they take the 2 areas that have the most what looks like might be cancer cells. They take those 2 areas and they go through and they stage the cells in each area. It's a stage between 1 and 5. Stage 1, if the cells look pretty normal. Stage 5, if they look very aggressive. And so then they take those 2 different sections, those 2 different biopsy sections, and they add the stages together. And basically, if you have a stage that adds up to be 6 or higher, then it's prostate cancer. So if it's 6, it's a low grade. And if it's 10, it's a high grade. That's just kind of a quick explanation of it. But the bottom line is that it's good news to have a low Gleason score. It's good news to have a low stage, like stage 1. And of course, it's the best news if you have no cancer, but we deal with what we deal with. And I like the way that he's approaching it. And I really pray not only for his physical health, but for his mental health as he goes through it, because he's also shared, that his father passed away with cancer. And so I know that he has some real life personal experiences with cancer and with dealing with mortality. All right. So did anyone answer, Shador? Did any of our med heads answer? Just what are some things, what are some suggestions for helping men to be proactive? Because I can tell you that for a lot of the men in my life, highly intelligent, they have all the sense in the world, but they just a lot of times delay or don't want to go get screened for cancer. So it's not an intelligence thing. Oftentimes it's not a lack of knowledge thing. Sometimes it's a fear thing, or I don't know what. So did anyone want to share?
Yes, I remember Miss Elaine. Hello.
Hi, Miss Elaine. Thank you for being a member.
For them to get regularly prostate exams if you are 40 or older.
Absolutely. And so, and I'm glad you brought that up. So according to the American Cancer Society and the American Urological Association has similar guidelines. So if you are a Black man, period, or if you are a man who has a first-degree relative, meaning a father, a brother, who was diagnosed with prostate cancer less than age 65, then it's recommended that you have the discussion of prostate cancer by no later than the age of 45. And then if you are so that's like if you are at high risk, okay? So if you're a Black man, you're automatically considered to be at high risk, okay? Spoiler alert. But even if you are of another race or ethnicity and you have a first-degree relative who had prostate cancer diagnosed younger than the age of 65, by no later than the age of 45, you should be having the discussion with your doctor about prostate cancer screening. That's according to the American Cancer Society. And then if you are at very high risk, then that's if you have more than one relatives. Okay, so 2 or more relatives diagnosed with prostate cancer younger than the age of 65, then it's recommended that by no later than the age of 40, you have your discussion with the doctor about your prostate cancer screening. And then if you're just of average risk, they say by no later than the age of 50. But again, if you are a Black man, then you automatically are considered to be at high risk. So definitely by age 45, according to the American Cancer Society, that's that. And then I'm going to tell you personally, I say by no later than the age of 40. Okay, so Dr. Frita's personal recommendation, no later than the age of 40 if you're at high risk, if you're a Black man. Official recommendation, if you're a Black man or at high risk, no later than the age of 45. And so with that, they'll discuss on the PSA, the prostate specific antigen. If your PSA is between 4 and 10, you have a 25% chance of having prostate cancer. If your PSA is greater than 10, you have a 50% chance of having prostate cancer. Okay. Other screenings can be the digital rectal examination. That's also controversial. Also, the prostate ultrasound, prostate MRI, but talk with your doctor and just go and face the music. Okay. What else do we have?
JN.
Hi, JN.
Go with them to get checked out.
Okay, so provide them a support where instead of just saying, hey, go to the doctor, say, hey, let's set up a time and I'll ride with you. That's a good idea. That's a good idea. Plus, it kind of forces a little accountability for them if you've taken the time out of your schedule to go. And it reminds them that you really care. That's a good thought. Yeah, go with them.
And speaking of caring, Mr. Randy, hello, long
Hi,
time.
Mr. Randy, how are you doing?
Mr. Randy says that's a great question, but just let them know that you are genuinely concerned and want them at their best.
I love it. I love it. Thank you, Mr. Randy.
All right.
Okay.
Over on IG,
Hey,
what's the name? Oh, Holly. Holly says she's making an appointment for her husband to visit the primary physician and take him there herself because he would not go otherwise.
That's good. That's good. So sometimes it's making an extra effort and being a little aggressive, right, Holly? And so I like that because a lot of men just won't go. But if you make the appointment, they'll go. If you go with them, they'll go. And I know they got to be, they're grown and all of that. But sometimes you need support. And when it comes to the health of your loved one, support them in any way you can. So I like that approach. That's good. That's good. Thank you for joining us.
Absolutely. Japo on IG as well, Dr. Frita. What can we do for encouragement? He says that I'm scared to go. So the fear, men have fear of going to the doctor maybe for this diagnosis.
Right. And I'm glad you said that because a lot of men they won't say that it's fear. They'll just come up with a million reasons. But the way that I think of it, because I'll tell you, as a doctor myself, I can sit here and tell y'all everything on every medical Monday from A to Z. But when it comes time to being a patient, it is fearful when you're walking into a room and you don't know what the doctor is going to say on the other side. You have to face the fact that you're not going to necessarily live forever. You're not going to live forever. You have to face the fact that it's possible that you're getting older, that you might have a health problem. And that is frightening, especially, if you have loved ones who are depending on you. All of that is valid. But here's what I say. Whether you go to the doctor or not, your diagnosis is your diagnosis. So you have two choices. You can ignore it and possibly have something like a cancer that festers, that spreads all over your body, that takes your life and your quality of life at an early age and that takes you away from your loved ones. Or you cannot go and ignore it. Or you can go and you can face it and have the chance of picking it up with an early detection and having a good quality of life. The point is, whether you go to your doctor or not, the disease is there. So you can take control of it by going, or you can ignore it and ruin potentially your quality of life. And that's all. And it's just a simple matter of making yourself do it and perhaps talking to a loved one and tell them, just like you shared with us, say, I'm scared, and say, can you just go with me and just get that accountability partner? But thank you for sharing. Yeah.
Absolutely. And Sheree, she's pretty much echoing what you're saying. Hey, Sheree.
Hey, Sheree.
She says, let them know that the final decision is theirs, but everything that they do or don't do has a direct effect on all those who love them dearly. No man is an island until himself assures support.
Absolutely. Absolutely. And of course, this message is for the men. And again, I applaud Funky Dineva, Q, Quentin, and really praying for the best for him. And I just appreciate his approach very, very much. And again, with him being diagnosed at an early stage, he is going to do well. Not only do I believe that, but science shows us, as long as he faces it like he's doing, he's going to do well. I just hope that him sharing will encourage other people. And so we're talking about men's health with him, but women also, I'm going to get my mammogram this month. We're in December. Oh, shoot, December came quickly. And every year I roll my eyes. Every year I'm just like, here we go. But I know that if, God forbid, I were to be diagnosed with breast cancer, at least by going regularly, it would be caught at an early stage, which would increase my chances of survival and being here for a longer time to be able to annoy my children, if nothing else. And so just do it for yourself and do it for your loved ones, and just go face the music and love yourself enough to go and get checked out. Okay. All right. Please give us a like, give us a share, give us a subscribe. Here on the Dr. Frita channel, we have over 920,000 subscribers. We're trying to get to 1 million. Make sure you follow me on all social media platforms. I post different things, different content, and a couple of things that are going to be coming up. Just kind of keep looking over the next couple of days on my playlist here on YouTube, specifically television appearances. I'm putting up the shows I've been on, like Don Lemon, where I was talking about the 2 viral videos of the pregnant ladies who were in active labor, where I've been on News Nation talking about the fact that high blood pressure in children has doubled, over the past 20 years. Can y'all believe that? This study was done in kids less than 19 years of age, and worldwide high blood pressure has doubled. And you already know that increases the chances for heart disease, kidney disease, all of that. So that's going to be on my playlist. And then just going back years and years from all the things I've done, some things on Paternity Court, some things on HLN, some things on The Portia Show, my playlist with television appearances. Just be on the lookout. I'll be having that right here on the channel. All right. Please do this, y'all. If you eat Campbell's soup, please put a chicken emoji in the chat. And please put a chicken emoji in the chat, because according to a whistleblower, one of the CEOs at Campbell's Soup, one of the executives, shared that the Campbell Soup, he called it poor people food. He made racist comments, allegedly, we'll say. He said that it wasn't even real chicken. He said it was made from a 3D printer. All of this was caught on tape, on audio tape. Campbell say they say that they can't verify that it's him. Nevertheless, the whistleblower has been fired. And so let's go ahead and let's play this clip. And let's talk about Campbell's soup. I'm curious to know how many chickens I see and how many of y'all eat Campbell's soup or have had Campbell's soup.
Campbell's.
Good. This morning, Campbell's Soup is denying claims about its products, allegedly made by an executive in a recorded conversation. The person in the recording is also heard belittling Campbell's customers during an expletive-filled rant.
We have that's for poor people. Who buys our I don't buy Campbell's products barely anymore. It's unhealthy. Now that I know what the in it, I can eat bioengineered meat. I don't want to eat a piece of chicken that came from a 3D printer.
The recording is allegedly from a conversation that's now part of a lawsuit filed by Robert Garza, a cybersecurity analyst for Campbell's, who claims he was fired after reporting the alleged remarks, which he says also included racist comments about company employees. Garza claims Campbell executive Martin Valley made those comments after the two met to discuss Garza's salary. In a statement, Garza's attorney saying, "This situation has been very hard on Robert. He thought Campbell's would be thankful that he reported Martin's behavior, but instead, he was abruptly fired." Campbell's responding, saying, "If the comments were in fact made, they are unacceptable. They do not reflect our values and the culture of our company." And going on to say, "The comments heard on the recording about our food are not only inaccurate, they are patently absurd."
It's amazing that the person who allegedly made the comments wasn't fired, but the person who reported it was. I can't wait to see how that lawsuit goes. And so that's Campbell's Soup, and this is, of course, a very messy and very unfortunate revealing of what the CEO of Foods potentially allegedly thinks while he's sharing the food, especially him calling it poor people's food, which gets me into the discussion. I want to talk about, what does he mean, poor people's food? And why in such a high income country as the United States is there such thing as poor people's foods? So I want to talk about food deserts. First, Shador, do we have a lot of chickens here? People have Campbell's Soup. Don't be shy.
Yeah, we have a few people chimed in. I have me a chicken to put in the chat as well.
Let me put my chicken in the chat. And we know, because we talk about it quite a bit, that, with Campbell's food, they're canned, they have, they're salty. And so with the high sodium content, it's not the healthiest thing. But definitely, I know a lot of us keep canned foods, especially for the quick go-tos, or sometimes using like the mushroom soup or a French onion soup, just kind of a family, or just kind of a household name, right? And in calling it a household name, especially now as we move into these cold months, just a quick meal sometimes people might grab. It's really unfortunate if the CEO is making racist comments, which has been alleged and caught on tape, according to the person who now has been fired. And for him to call it poor people's food, that bothers me. Okay, but let's talk about food deserts. Let's talk about what poor people's food is. But here's what I want. I want also for folks, if people put chickens and put comments, we'll take those. But also I want now to ask the question. I want you to put an apple emoji, a nice healthy apple, an apple a day. Put an apple emoji and share some of your go-to affordable healthy meals. Okay. And so perhaps this can help someone who is in low income or who's living in a food desert. Affordable healthy meals. What's your go-to affordable healthy meal? Put an apple and give us some tips. Okay. Did anyone put any actual comments next to their chickens in the chat?
Yes, they did.
Okay. I love y'all for being participating so much. I do.
A few of them actually have stopped eating camels, but have in the past. Our VE, hello.
Hey, VE, welcome back.
She says, since become a patient of Dr. Fisher, I no longer eat the soup due to high sodium content.
All right, VE, very good, very good. It is true. Okay, so see, I didn't even know you made that comment before I made my comment about sodium. We know that according to the American Heart Association, it's recommended that most adults have no more than 1,500 milligrams of sodium in 24 hours. If that sounds like a lot, it's not. Because if you think about just a teaspoon, not a tablespoon, think about a teaspoon. In fact, a quarter of a teaspoon of table salt is anywhere from 560 to 590 milligrams of sodium or salt. And so if you even have 3/4 of a teaspoon of table salt, you've already exceeded the daily recommended intake of sodium according to the American Heart Association. And for those of you all listening and you're like, oh yeah, I don't really do salt. I do pink salt. I do pink Himalayan salt. I do sea salt. I do kosher salt. It's still salt. It's still sodium. And yes, some of the pink Himalayan salt has some minerals, some magnesium, some of those benefits, but it's still salt. So make sure you're a label watcher. And if you are a label watcher, you'll see that a lot of the Campbell soup is loaded down with sodium. Now, when I say that, make sure you understand, I say it without judgment, because I do understand that especially for people who are in low income areas, or if they don't have refrigeration, then a lot of times it's a matter of survival, and soup is something that's inexpensive. Or if you're in a situation now, especially if you were affected by the shutdown or by some of your benefits have been cut, then you may have had to go to food pantries. And because food pantries need to keep foods that are able to be preserved for a long time, that means they have a lot of canned foods. So I'm not judging you. I mean, survival versus not survival. A lot of times people do rely on Campbell soup and other soup products in order to live. But that's good for you, VE Hall. VE, thank you.
Miss Erica, hello.
Hello, Miss Erica.
She says, Dr. Frita, I stopped eating it, but grew up on it. Just made my own chicken stock and about to make my own soup.
Oh, that's good. That's good. Listen. And so when I was at my cousin's house, there was the turkey. We tore that turkey up, y'all. It was a done deal. But still, there was a lot of, a little bit of skin here and there. Some of the white meat was left. And she's like, I just can't throw it away. And so she's going to boil it. She's going to make her own turkey stock. And so that's actually a really good idea. Okay, good.
Sheree.
Hi, Sheree.
She says only cream soups 2 times a year for Thanksgiving and Christmas. So she used the Campbell's cream soups for her.
Okay. So that might be what I was talking about. You kind of toss it in there a little bit, in maybe in a dressing, or toss it in, and we all know everything with moderation. When I talk on this channel, I don't speak in absolutes, but as long as you know overall and you're, doing low sodium most days of the week, or you're conscious of it, that's what we're all about. But Campbell's had some answering to do if they're making racist comments, and if they're saying that their food is from 3D printers, and if it's poor people food, if that's a label they're using, poor people, and who exactly they're talking about when they say poor people. Okay, so as we talk about food deserts, don't forget, please, to go ahead and put your Apple in the chat and give us some go-to affordable healthy meals that you can recommend, especially for folks who are trying to kind of pinch pennies right now, which is pretty much a lot of people. Even if you have a lot of pennies, it's best to pinch them because you don't know what's happening. But basically, we're talking about food deserts. We're talking about places that have limited access, very limited access to healthy foods. And so there are different specific definitions, like according to the USDA, if you're in a place where 20% of the population, if they have like very low income, if they don't have access to healthy foods, then it can be considered a food desert. Or if you're in an urban area and 33% of the people are more than a mile away from the closest grocery store, that's considered a food desert. Or if you're in a rural area where 33% of the people are 10 miles away from the closest grocery store, that's considered a food desert. Okay, so people who don't have access to healthy foods. What's significant about that? Well, one, people in food deserts, we tend to be talking about patients who have low income. And so if they don't have access to a grocery store where you have fresh greens, fresh apples, fresh carrots, fresh fruits, beets, then what do you have access to? Ultra processed foods. Your grocery store might be the Family Dollar, or might be a place that doesn't necessarily have all the refrigeration or all the produce. And so if you're low income and you're in a food desert, then that's going to put you at high risk for certain diseases like high blood pressure, right? Due to all the high salt content. It's going to put you at a higher risk for diseases like diabetes, because likely there's a lot of ultra processed foods with high fats, high carbohydrates. It's going to put you at an increased risk for obesity if you don't have the low calorie green vegetables and fresh fruits, but you mostly just have the unhealthy, high calorie, starchy foods. You're at a higher risk for obesity. And of course, that's going to lead to you being at a higher risk for heart disease, strokes, all of that. And so having these food deserts is a major problem. And it's something that certainly needs to be tackled. But when you do things like decrease SNAP benefits, okay, decrease EBT cards, food stamps, what they've been called, when you decrease those access to those things, and you have people living in a food desert, well, now you're just really negatively affecting the survival of those who have the least among us, those with low income. And so just in this era, to hear that allegedly an executive of Campbell's, who I'm quite sure does not live in a food desert, for him to be calling his product poor people's food and just kind of proudly, being the CEO of a place where, according to him, allegedly, he's giving just a poor, low quality product to those who can't afford, other, fresh soups. It's just really low. It's just really low. So I will be following this story. Okay. So do we have anyone who put any apples in the chat just to give us a few quick kind of go-to affordable healthy recipes? Because y'all know these fresh foods, these organic foods are not cheap.
Yeah, absolutely. Miss Aileen.
Oh, hi, Miss. I should have known Miss Aileen will come through. Hi, Miss Aileen.
Miss Aileen says brown rice and beans.
Okay, so the brown rice as opposed to white rice, so that's less ultra processed. When it's a brown rice, then it's going to be more likely to be a whole grain and not stripped of all of the nutritional benefits. Okay, and then beans. Okay, we talk about legumes, we talk about beans. That's a protein source, a fiber source, and we know that having high fiber is a way to unclog the arteries naturally, right? That can help to decrease your cholesterol. It's also a way to fill up on good proteins, and so that once you're full faster, then you're not necessarily overeating. Okay, so that's something good. And of course, everything in balance, but that's the way that's something that's inexpensive that could be a go-to source. Very good. Yeah. Of course, if you're living with diabetes, always consult with your doctor because you still need to count your carbs and your starches. Okay, thank you.
All right, just like that. Hello.
Just like that. Okay.
Just like that says cabbage, carrots, rice, no canned foods, oatmeal, and prep meals ahead of time, and no salt.
Okay. That's good. That's good. And cabbage is not incredibly expensive, is it? So when we talk about cabbage, that's one of those cruciferous vegetables. So especially red cabbage with all that good old color, ooh, eat the rainbow, is loaded with antioxidants, with vitamins, with anti-inflammatory. So things like cabbage and other cruciferous vegetables are things like Brussels sprouts, cauliflower, broccoli. These are vegetables that are loaded down with antioxidants. So cabbage is a good way. It's filling, it's low calorie, and it's affordable. I like that. Carrots as well. Carrots can be good for vision, which is awesome. A nice source of fiber, especially if you don't really cook them. If you kind of have raw carrots, that's something that's good for your digestive system as well. Very good.
Over on IG, GV Boss
Hey, GV Boss.
says
What you got?
pasta.
Pasta. Now, pasta is affordable 100%, but if it's the traditional pasta, like the white pasta, then that's one of those things that's inexpensive, but it actually tends to be ultra processed, at least the way we make it here in the United States. It tends to be ultra processed. But I will say, if you are talking about a pasta that's made from vegetables, like zucchini pasta or squash pasta, then that's certainly something that can be healthy. I haven't checked the price on zucchini pasta or squash pasta. If anybody is in the chat and you know it, just kind of put that in there next to an apple. If doing a vegetable pasta, if that's something that's somewhat affordable, because a vegetable pasta would be something that's an affordable, healthy choice, if indeed a zucchini pasta or a squash pasta. But you know what? You can make your own pasta. Shoot, you can get your own zucchini, purchase your own zucchini, and then make a zucchini pasta at home. They have like these pasta makers, whatever kind of tools, we can make it at home. So that is something that is affordable. But specifically a vegetable pasta, not the enriched processed pasta. Yeah, thank you.
Mm-hmm. All right. Lisa.
Hi, Lisa.
Jay, she says clean eating for years, grains, fruits, and vegetables, salmon, and chicken breasts.
Very good. Very good. Now, these are definitely healthy choices. I have to say, not always affordable, sadly, in our economy. Chicken, there was one time chicken used to be cheap, but have y'all looked at the prices of chicken? Oh my gosh. But if you are able to afford it, specifically white meat chicken with taking the skin off and baking it, grilling it, not frying it, that's a healthy choice, not always affordable. And then going and finding the fruits and vegetables that are not expensive. But you see how difficult it gets, because if you're in a food desert, then you're not going to have easy access to these things. Mm-hmm. It's tricky being healthy and affordable. Yeah. Yeah. Congratulations on your clean eating. Very good.
Yolanda, we'll read your comment. Self-gardening, lentils, jasmine rice, kale, and carrots.
Self-gardening. If you grow it yourself, then that's definitely going to make it affordable. That's awesome. All right. Well, these are good. Let's keep this conversation going. Keep the conversation going in the chat. Anyone who's listening in the replay crew as well, put an apple there and give us some affordable, healthy eating choices so that we don't have to eat poor people's food, if indeed that's what that CEO said. Ooh, that made me mad. All right, let's flip into my favorite game, Shador, shall we? Yes. Myth versus fact. Myth versus fact. So we had some sad news initially with what looks like a good outcome, and that is the Grammy Award-winning artist, Donald Glover, also formerly known as Childish Gambino. He's 42 now, but he actually shared that he had a stroke when he was 40, right before his 41st birthday. And the reason for his stroke was not the typical reason you think of, like living with obesity or having high cholesterol or being sedentary. No, he had a stroke due to having a hole in his heart. So let's play this clip, and then I'll talk to you about Donald Glover, aka Childish Gambino.
Talk.
This morning, actor and rapper Donald Glover is opening up about a major health scare, revealing he suffered a stroke while on tour last year.
I had a really bad pain in my head in Louisiana, and I did the show anyway. I couldn't really see well. So when we went to Houston, I went to the hospital, and the doctor was like, "You had a stroke."
Over the weekend, the Grammy and Emmy-winning artist telling fans that doctors made a concerning discovery.
And they found a hole in my heart. So I had this surgery.
Approximately 10% of all strokes occur in individuals between the ages of 18 and 50.
Especially in younger folks, you start to think about, is there an issue with the structure of the heart that's causing an abnormal communication between the right and the left side of the heart?
Glover, who performs under the stage name Childish Gambino,
This is America.
and starred in the cult favorite Community.
She calls bagels bagels.
Reminding fans not to take life for granted.
Yeah, that was a sad story. The only thing that really makes it not so sad is one that he survived, but that at least from how he presents, he doesn't have any obvious deficits, any obvious complications from that stroke. Once we finish this live, I want y'all to make sure you look at my YouTube shorts. And I have a short that I did on Childish Gambino, Donald Glover, on what it is to have a hole in the heart. A hole in the heart. So, but let's first get into our myth versus fact. What's our first myth versus fact statement?
Yes, ma'am. First statement is a hole in the heart is a rare and severe defect.
Okay, put an M1 if that's a myth. Is it rare and severe? And put an F2 if it's a fact. I'm sorry, F1 if it's a fact. An M1 if the statement is a myth, and F1 if the statement is a fact. Is it rare? Is it severe? Okay. I know I didn't give y'all much time. Y'all don't need much time. Y'all are warmed up. Any medheads already started to answer the question. Let's first go let's go into statement number 2.
All right. Statement 2, holes in the heart are always dangerous and must be treated immediately.
This is a good one. Put an M2 if this is a myth. Put an F2 if this is a fact. Pencils down, pencils down. All right. In this short time, do we have any takers, Shador?
We do. We do have some takers.
All right. Let's go to myth versus fact statement number 1. If you could read that again for me, please, Shador.
Absolutely. A hole in the heart is a rare and severe defect.
Okay.
All right. So we have Anton.
Hi. Oh, welcome, Anton. It's good to see you again.
Anton says it is a fact.
Okay.
Our member, Ms. Andrea, says a fact.
Thank you for being a member. Okay.
Yolanda says a fact.
Okay.
Audrey agrees. CC agrees a fact as well. And Lisa J, going against the grain, she says it is a myth.
Oh, Lisa J, how dare you? Okay. So this one was actually a tricky one because rare, severe, that lets me know that probably a lot of people haven't heard of it. But guess what? This is actually a myth. It's actually a myth because you know what? Having a hole in the heart is not rare. Can you believe it? 1 in 4 adults has a hole in the heart. Okay, 25%. That's not rare. And so let's talk about it. Let's talk about it. Oh, this is good. Okay, this is a good learning opportunity. So what do I mean by a hole in the heart? So very likely he had something, Donald Glover, Childish Gambino, had something called a patent foramen ovale or a PFO. And so all babies before they're born, okay, all fetuses have a hole that goes between the 2 top chambers of the heart, okay, the atria. And that hole is needed in order for the fetuses to get oxygenated blood before they're born. Once a fetus is born and is now a lovely little newborn baby, that hole closes. Okay, it closes, you take your breath, and now you're getting your oxygen yourself from your own lungs. And so you don't need that hole in the heart. And so there's a rerouting of your circulatory system. I won't go into too many details, but bottom line, it's normal to have a hole in the heart while you are in your mama's womb. But once you're born, that hole closes. Early on, it closes for newborns and it closes for almost everybody. But in 25% of the population, they keep this PFO, this patent foramen ovale. So it's pretty common. The thing is that for most people who have this hole in the heart, most of them do okay. Okay. And a lot of times it's picked up by pediatricians because there will be a murmur. Okay. A murmur when the pediatrician listens to your heart with a stethoscope. But as long as you're doing fine and as long as the hole is not too big, then yeah, most people just kind of move on and they do fine. The problem is when the hole in the heart is large and then when it causes other complications, which we'll get into. But the point of the matter is that 25% of adults are walking around here with holes in the heart. Most don't even know it. And so it's really not rare. It's really not rare. And so that's why it's a myth. It's kind of common. Yeah. All right, let's see, myth versus fact, statement number 2, and then I'll go in to talk about what constitutes when it's a severe issue or when it's a problem. Okay,
All
feel
right.
free to
Statement
begin.
2.
Yeah.
Yes, ma'am. Holes in the heart are always dangerous and must be treated immediately.
Okay, what do we have here?
All right. So we have VE says a myth.
Okay. Hi, VE.
Lisa J says a fact.
Okay.
Anton agrees it's a fact.
Ooh. Hi, Anton.
Sherry Hello says a fact.
Okay.
Our member, Miss Elaine, agrees. Fact as well. J. Doug says a myth.
Ooh, J. Doug.
Yolanda says myth as well. And over on IG, One of a Kind says it is a fact.
Hey there, one of a kind. Thank you for joining us on IG. Okay. So the question is, or the statement is that when someone has a hole in the heart, that pretty much it must always be fixed, right? So once it's discovered, boom, you need to go get a procedure, get surgery. This is actually a myth. It's a myth because one of the big hints that you now know is with 25% of adults walking around with holes in the heart, you know that 25% of the population is not getting them fixed. And truth be told, that for most of the holes in the heart, if they at least get small, then they don't have to be surgically fixed. They don't have to be surgically fixed. Now, here's where there is an issue. Certainly, if you've had a stroke, such as what Childish Gambino had, and Senator Fetterman, I believe, I know he had atrial fibrillation, but I believe he also had a hole in the heart, which is why he had a stroke. But if you had a stroke, then certainly it's something that needs to be corrected. And now there are different ways to correct it. You don't necessarily have to have an open heart surgery, but there are less invasive ways. Also, if that hole is large enough where it's causing a lot of the poorly oxygenated blood to be mixed with oxygenated blood, and it's causing you to have a problem where you have hypoxia or low oxygen, then it would need to be fixed. In some cases, again, when it's a large hole in the heart, it can cause you to have congestive heart failure, even pulmonary hypertension. In that case, the hole in the heart would have to be fixed, or corrected surgically or by some procedure. But honestly, in most cases, when the hole in the heart is small enough, you might have a really loud murmur. And interestingly, the louder the murmur, the smaller the hole. So the louder the murmur, then the less likely you're going to need to get it fixed. But when I say that, make sure that you consult with your doctor. If you have a murmur, been told that you have a murmur, then, talk to your doctor about being referred to a cardiologist, because certainly there are ways that they can see if it's a hole that needs to be fixed. The bottom line is that having a hole in the heart does not necessarily automatically need to be fixed, only if it is something that's large and you're getting a lot of poorly mixed blood, and certainly if you've had a clot. So here's just some imaging I want you to take a look at. We have you can see the 4 chambers of the heart. And if you look on the image to the left, you'll see that in that case, the hole of that PFO, patent foraminal valley, has been closed the way it should be. And so all of the oxygenated blood is on one side of the heart, and the unoxygenated blood is on the other side. But if you look on the picture to the right, you'll see that there's a hole. And when there is, then you have blood that can go from the right side of the heart to the left side of the heart. And if you were to get a blood clot, like a DVT, a vein in your leg, and if it were to go up, instead of that clot going to the lungs, where if it's small enough, it might get caught there and you do okay, it can possibly go straight from the right side of the heart to the left side of the heart and then up to the brain and cause a stroke. And that's what typically happens with holes in the heart. Anyway, please make sure that you take a look at my short form content. I have a short here on YouTube for you to check out. And so if you just put Dr. Frita Childish Gambino, I go into more detail. And if you have any questions, just make sure you put them in the comments there, or put them in the comments here. And then we'll kind of keep moving. But yeah, it's not very commonly known about, clearly, but the holes in the heart are actually pretty common. Yeah. All right, let's move on into our second weekly dose, where I give you a fresh take on the headlines you simply can't get anywhere else. Norovirus, you've heard us talk about it here before. It's on the rise. The cases are doubling. So let's play this clip, and then we'll just talk quickly about norovirus and what you can do to protect yourself and your families.
All right.
Norovirus. We always call it the worst stomach bug, right? It's a contagious virus that is often referred to as stomach flu. And now cases are on the rise across the country. The CDC reports the number of tests coming back positive for norovirus is now at 14%. But just 3 months ago, the rate was 7%. So we're on the lift. We are still off the record numbers of last year in December when 25% of those tests came back positive. But here's what you need to know. While cases are up in the country, the data finds Texas, Oklahoma, Alabama, Wyoming, and Nebraska are reporting the most cases. The most common symptoms of norovirus are diarrhea, vomiting, nausea, and stomach pain. Now, doctors tell us the symptoms usually develop 12 to 48 hours after you were exposed. And one thing to keep in mind, hand sanitizers were the weapons that we all used against COVID. They do not work well against norovirus. The best way to avoid norovirus is to wash your hands frequently with hot, soapy water, particularly after the bathroom. Now, clean and disinfect all contaminated surfaces, but here's what you use: a bleach-based cleaner. If you do this, it will make a big difference.
That's it. Okay. And so the message is hand washing. And I'm just listening to those places where the norovirus is on the rise the most, and just the likelihood is that we don't have as much hand washing going on. And one of the main takeaway points is that, again, even though hand sanitizer is something that we use during the lockdown, hand sanitizer does not work well for norovirus. You know, the norovirus is spread easily in places where there's close contact, like in cruise ships, like in nursing homes, like in daycares where people are close to each other. And so washing your hands, especially after you use the restroom, with soap and water, y'all, please be clean. And after you go and you touch doorknobs or you touch elevator buttons, please don't go and snack and dig your hands and things. Wash your hands with soap and water, especially now that you know that norovirus is on the rise. The good news is that it's normally self-limited, okay? Doesn't last that long, 1 to 3 days. But if you find that you're having vomiting, diarrhea, you can't keep anything down, especially over 24 hours, then please consult with your doctor or go to the ER, especially with elderly people and with little babies who can get dehydrated very easily. Okay, so just remember, the more you know. And once you finish watching the slide, make sure you check out my YouTube short on norovirus. If you put in Dr. Frita norovirus or Dr. Frita norovirus, Lil Scrappy, I go into detail from when Lil Scrappy shared that he had norovirus last year, I believe. All right, please go ahead and give us a like, give us a follow, give us a subscribe, follow us on all social media platforms. And remember, go to drfrita.com, DRFRIT, as in take care of yourself, A.com. That's the one-stop shop where you can see all of my blog posts, all of my videos, all of my television appearances. And you can see my favorite things where I share my favorite weights that I lift. I'm trying to say in somewhat of a shape. Oh my gosh. I have on there my favorite juicer where I give you a discount code. I have on there my favorite blood pressure cuffs for you to monitor your blood pressure at home. So check out drfrita.com. That's my one-stop shop. All right. Let me ask you this. Now, y'all are sitting up here on YouTube, on other social media platforms, on the replay crew, and I have a good feeling that a lot of y'all use a lot of social media. Well, what would you do if I tell you that there now has been a study by the American Psychological Association that watching a lot of short form content on social media can be causing brain rot? I'm not making that up. Let's play this clip and let's talk about it.
Of us checking Instagram, Facebook, TikTok, other social media is all part of our normal routine, right? And keeping tabs on friends and family across the world can help to make you feel more connected. But there's a negative side to that unchecked screen time, which can lead to poor sleep, memory issues, and poor overall mental health. Joining me now with more is Vaibhav Devarkar, a professor of psychiatry and behavioral neurosciences at Wayne State University in Detroit, Michigan. Professor, thank you so much for joining us. We appreciate it. So why is social media so addictive, and why do we feel that burst of happiness when someone likes one of our posts?
Thank you, Whit, for having me. Well, I think one of the problems with social media and the incessant novelty that it generates is it keeps the brain in what is called constant exploratory mode. And so the brain is constantly now in a position where it's looking for novelty, but it's actually never settling on anything. And we always transition in our own lives between exploration and exploitation. We look for things, but then we settle on something and we use it. The problem with social media is it actually engages many of the same addiction mechanisms. It's not the same thing as substance use addictions, for example, but I think in the brain, it engages many of the addiction mechanisms which keep people glued to the constant act of looking for things, but never settling on anything.
Let's talk about it. That's a little scary. That's a little scary. I do want you to do this in the chat. Put a brain emoji. Okay, if you can't find a brain emoji, just put brain, write brain in all caps. And I want you to tell me if you notice that your attention span is shortening or changing because of social media. So answer that question or answer the question, what is one thing you can do this week to be more mindful and present? Even if you're someone who does use social media, what's one thing you can do this week to be more mindful and present? Okay, so put a brain emoji and tell me if you notice a difference with yourself with attention span using social media, or what's one thing you can do this week to be more mindful. So yeah, so there was a study, American Psychological Association, and they looked at over 70 studies, over 100,000 participants. And it really was found that the more people who use social media, the more you use social media, there was an association with a poorer concentration, a poorer focus, which I guess if we think about it logically, that can make sense, but it's pretty scary, right? Because a lot of us use a lot of social media or we flip through. And I'll just share about myself, and I'm curious to see what our med heads say, that I do notice myself that sometimes I'll just be doom scrolling. And if I'm looking at a post, they might have 5 seconds to say something to make me laugh or to intrigue, or say something to make me laugh or to intrigue me. And then I'm scrolling and then I'm scrolling. And there was a time where I would find that when I went through the short form content, because it's only going to be like 1 minute or 3 minutes most of the time, I would sit and I would listen, I'll be patient. But now that I'm learning about the study and I'm looking at myself and being honest with myself, I really do sometimes. I'll sit there and in 5 seconds, if I'm not laughing or intrigued, boom, I'm moving. Boom, I'm moving. So does that mean that my attention span is lower? Is my, entertain me quickly, or you've lost my attention? That's kind of scary. And is that brain rot? Oh my goodness. And if it's happening, so you notice they're not just talking about kids, because we always say, oh, you kids, it's too much screen time, you're doing all those video games, but it's adults also. And so it really is important to be honest with ourselves and to check ourselves. And are we always attached to our phones? Do we need to be more mindful, more present? Did anyone make a comment on anything that they might do to be more mindful, more present? Because I'm honestly really thinking about this thing.
Yes, we do have some comments on the brain rot.
Okay.
Erica shared. She says, definitely feel like social media has affected me adversely. I need to read more physical books and limit the time on my phone.
That's good. That's good. Yeah. And it's important to have insight and to be honest with yourself, right? Mm-hmm. Yeah.
Ms. Aileen, she says, that's very scary. My coworkers always say that about me. I'm not paying attention.
Ooh, that's interesting. So this will make you really kind of pay attention and check yourself. And I'll tell you for myself, I really notice it like at dinner. If I'm out to dinner and I'm telling the kids, get off your phones, put your phones down. And then here I go.
You pick yours up.
I pick mine up. Mom, what are you doing? I'm like, wait, I got to see what's going on in the news. I have my reasons / excuses, but can I not sit down? So I'll tell you one mindful thing that I know I can do is have protected time. Okay. Like, especially at meals or just, when there is free time to sit down instead of just going and being on the phone, perhaps reading a real book or having a real conversation with someone or going for a walk, maybe being intentional about setting time where there's no screen time, because nobody needs to be on this phone 24 hours a day. But sometimes I feel like I kind of am. Okay. Anyone else?
Sweet Quiet Storm.
Ooh, hey there.
Sweet Quiet Storm says, I'll just put the phone down. Work is just like this with the information shared on internal Facebook, short form videos, and etc.
Okay.
And then Lisa J says she looked for something educational or something spiritual only.
That's good. Okay. So kind of making it so instead of you just getting caught up in just silly stuff or maybe junk or maybe instead of just being caught up in things that are inflammatory or that can cause division, just maybe looking for things that are enriching and that feed the soul or feed the mind. So being intentional about that, that's a good change. Thank you for being so active today too. Yeah.
And then on IG,
hey, IG.
Rach says can be more active with less screen and sedentary time, spend some time with others and do crosswords, etc.
Very good. Crossword puzzles. Like, you know what? I'm sitting here thinking when I was growing up, we had the funny papers. Yeah, that's what we called them on Sundays, cartoons. Now my kids don't even know probably what a real newspaper looks like because every cartoon is on the screen, and then they don't even have to bother reading a cartoon because everything is animated. So then by your saying that makes me think of how crossword puzzles used to be in newspapers, magazines, and that's something that you do physically. It helps to keep the brain sharp and engaged, and it's not screen time. So that's good. I like that.
Absolutely. And then Martin on IG says try to read daily and seems to help. So reading daily seems to help, Martin.
That's good. That's good. So that's a way to be mindful, to be engaging instead of just flipping, and being addicted, because that dopamine surge they talk about is real. The dopamine surge that comes from this short form content it takes more. You need more, more things to stimulate you. It needs to stimulate you more quickly. And this really can, according to this study, lead to something called brain rot. And who wants a rotten brain? Not me, not you. And so, y'all, I want you to make sure, I thank you everyone for joining, for being so active. Please make sure that you keep the conversation going. Those of you who are watching the replay, crew, please do comment. Please give information, especially that part about healthy, affordable ways to eat, okay, even if you're kind of watching your money or if you're in a low income situation. I thank you all for watching. Please make sure you go ahead and give us a like and share this information, even for people who weren't able to be here. They're back to work after the holidays. Share it so they can watch it. Follow me on all social media platforms. Check me out on drfrita.com. That's my one-stop shop. And if you want to carry on a conversation one-on-one, I do offer a telehealth concierge service where I take the time, I take a full history from you, and I can share with you. As I mentioned before, I am a medical doctor. I have been quadruple board certified. I read medical information, medical journals every single day. No exaggeration. Even on holidays, I'm reading. I am. It's fun for me. Honestly, that's not brain rot. I enjoy it. And I also enjoy sharing the information. So make sure you click the link in my description or go to drfrita.com and book a telehealth concierge. And I'd be very happy to talk to you. I've been having great success with the concierge service. I can talk to you from anywhere in the world. And to find out my favorite things, like my favorite blood pressure cuff, my favorite juicer, go to drfrita.com or click the link in my bio for my favorite things. And of course, be sure to take click the link in the description and get my book, Under Pressure, A Guide to Controlling High Blood Pressure, where I talk about how to lower blood pressure naturally. And I talk about medications. And so you want to make sure that you take a look at that because I have an integrative approach. And speaking of which, I also talk about how you can possibly get off of medications. Please don't get off of the medications unless you're doing it under the supervision of your doctor. But check out my latest YouTube video where I tell you how to get off blood pressure medications safely. This is a guide. Again, please do not stop or change your blood pressure medicines unless you consult with your doctor first. But I certainly give you some good tips and a good conversation starter to take in to see your doctor. All right. So I thank y'all. Shador, of course, I thank you. And for my members who are members at the highest tier, we're about to have our live Q&A. So instead of me doing all this yapping, it's your turn to talk. And you can ask me all your questions about your medical information for the entire session. We're clicking over to do that now. I thank y'all for watching. And I thank you for making Monday your healthiest day of the week.